What I'm about to show you are the labs of a female who is in her 30s who is struggling with all things hormonal after being on birth control for several years. So she is now developing severe acne along her chin, along her forehead. She's seeing excess facial hair growing, having mood swings like never before, absolutely no sex drive. And so this patient stopped birth control 4 months ago prior to coming in, thinking that that would help her symptoms die down a little bit, but none of her symptoms changed. So she's been to several doctors. Really the only thing that she was offered was another form of birth control. She eats healthy, she moves her body, she exercises regularly, she watches what she puts in her body, on her body, and yet with all those diet, sleep, and exercise changes, still not getting better. So we ran labs to find out what are the causal factors for why this is happening. So let's take a look at what we found. The very first thing that we're looking at here is a section of the Dutch test that is breaking down her adrenal gland function. So off the bat, metabolized cortisol, very low, way beneath this yellow star. But at the same time, her daily cortisone pattern is picking up toward the end of the night here, while her cortisol, super low. So she is not producing near enough adrenal hormone. And just to back that up, total DHEA production trending low as well. Here we are looking at all of her sex hormones, all of her androgens, all of her estrogens, and her progesterone as well. So very low amounts of the androgens all around. So they're all trending on the lower end here, but as well as estrone, estradiol. But then we have estriol and 16-hydroxy cranked up really high. So this is a conversion issue. As well as this last pathway down here, we are not getting rid of a lot of her hormone, which is definitely contributing to a lot of the issues here. So we know it's a conversion issue. On her blood work, we are seeing high autoimmune thyroid markers showing that her immune system is involved and her body's inflamed to a point now to where it's attacking its own tissue. Then her homocysteine is elevated as well, and very low vitamin D. So we found what was causing her symptoms, and we were able to start on a few specific supplements that she needed based off all that lab work. And we had her make a ton of lifestyle changes too, some of which she did not want to make, but we needed to. So if you are somebody that is struggling hormonally, especially after the use of birth control, or hey, maybe you're still taking that birth control and you're not seeing your body change and come back to normal, well, we have to figure out why that is. So comment testing down below. We will reach out to you because we have to get your body tested and look at where hormonally that issue is and how to get back to normal.